This is Dr. P here, and I get a lot of questions about meniscus tears. The meniscus is in the knee. It's the shock absorber cartilage in the knee. There's two types of cartilage in the knee. There's the cartilage on the end of the bone, which looks kind of like the white on the end of a chicken bone. That's called the articular cartilage. That's like the tread on a tire. When that wears down, that's what arthritis is. Then there's the meniscus cartilage, these little shock absorber cartilages in between the bones. This is the thigh bone, femur, shin bone, tibia, kneecap. Looks like this, it's a right knee. The meniscus is the shock absorber cartilage. That's usually the cartilage you hear about, like when an athlete tears the cartilage in their knee. You can see there's an inner one and an outer one, a medial meniscus and a lateral meniscus. The medial meniscus tends to tear a little more commonly than the lateral meniscus because the lateral meniscus has more mobility. But either way, people say, oh, I had a meniscus tear and my friend did great from surgery, or my friend had a meniscus tear and I don't want surgery because they did terrible. Well, the meniscus, first of all, there's two of them in each person, and then there's two in each knee, and the meniscus is kind of like a snowflake. There's no two snowflakes that are alike, so there's no two meniscus tears that are alike. You can have a tear anywhere on the surface here. It can be horizontal, going this way, it can be vertical, going this way, it can be a flap, a piece that flips back and forth, it can be what we call a bucket handle, where a piece flips all the way from here, all the way into here. There's degenerative, meaning it's just kind of worn out. There's complex, it's just shredded. There's all kinds of meniscus tears, partial tears. Just because you hear the term meniscus tear doesn't necessarily mean your treatment's going to be exactly the same as your friend who had a meniscus tear. Not all meniscus tears need surgery. Not all meniscus, quote, tears need surgery. A lot of them do need treatment. Some do need surgery. They're all different, and the way we treat these is we treat them, first of all, figure out exactly where the tear is. Age matters, activity level matters. We sit down, we spend a lot of time with you. We might spend a full hour with you going over what you have and what your goals are. And once we know what your goals are and what your symptoms are and what your diagnosis is after we diagnose everything, we set up a specific, individualized, personalized plan for you. Bottom line is, not all meniscus tears are the same. Not all people are the same. And not all treatment plans for the meniscus are the same. There are some generalities, but in general, we treat each patient differently, each meniscus tear differently, and I hope that helps clarify that not all meniscus tears get the exact same treatment.